Hey, this is Dr. Birchler from the Chiropractic Health Center. One condition we see in patients that we help with is called neuropathy, and this is a challenging condition and possibly different underlying problems of what actually is causing that. I would say a commonly misdiagnosed problem in various ways, and with misdiagnosis sometimes treated incorrectly or with ineffective means of treatment. So neuropathy is a general term that kind of means nerve pain, and people would typically use that for the feet. That's the one that people will tend to have the most severity with and debilitating, because when they try to walk or stand, feel like their balance isn't good, feel like it hurts, and all these kind of things there. Though neuropathy could happen in other sections of the body. One of the big questions with neuropathy is what is causing that. So neuropathy is kind of a symptom. Hey, that you have nerve pain or burning or tingling or feel like ants crawling or different things like that. And that's a feeling, but what is causing that feeling? A lot of people, when the term neuropathy gets used, they may presume that it's what's called diabetic neuropathy, where somebody has high blood sugar, diabetes, and over time there's some kind of damage to the nerves that what's called the peripheral nerves, or nerves in the feet, that cause that. And that's certainly possible. That is one source of problem. That being said, I would say it's very common, possibly more common than not, that there is a physical explanation for a good portion of neuropathy, where the nerve is not damaged by blood sugar or chemicals over time. There's actually a physical compression to the nerve that's happening in the spine. What I'm showing here on the screen, this is a picture representation from research studies that pain map different nerves that come out of the back and can cause symptoms into the legs and the feet. And this shows what's called the L5 nerve. And what you'll note here is, if you're looking at somebody's leg from the front, and it could be either leg, when somebody has a sense of tingling, numbness, burning that happens kind of from the knee down and may go down into the feet or the toes, and most particularly the toes other than the little toe, this nerve can be involved. And while the symptoms might be very prevalent here in the leg and foot, the problem is actually in the spine, where the nerve comes out of the spinal column, and various issues in the low back can cause that. Now, if we would look at what's called an MRI of the back, assuming I can find this here. This is what's called an MRI of the lower back, and it may look something like this, where you have vertebrae and you have discs between them. And this shows a combination of things. It shows a disc where there's called a degenerative disc. It shows a vertebrae that has a malposition called a spondylolisthesis, and then it shows a disc that has some level of what's called a herniation. And then there's also some thickening of the joints or the ligaments that, in addition to this disc herniation, create a narrowing or constriction where the nerves are coming down through the spinal canal. And this problem at this particular level, which is called L4, L5 in the spine, is one of the common physical issues that will end up with neuropathy of the legs and the feet. But if you haven't had a proper evaluation, you've never had an MRI of the back, you might not know that, or somebody might use the term neuropathy and start checking blood sugar, and you might think there's something else going on. And while those things are possible, it's nice to actually get a full evaluation and know whether there's a physical cause for the neuropathy. Now, that being said, some of the factors that would suggest that a neuropathy might be coming from the spine and maybe more likely to be able to be helped by getting pressure off of the nerves would be if one side is different than the other, meaning one foot or one leg is different. If it was blood sugar, it would probably be more symmetrical on both sides, whereas a lot of times bulges and compression are different one side than the other. Another thing would be, are you diabetic? Do you have diabetes? Have you had long-term chronic blood sugar issues or not? And if you don't, well, probably not diabetes. There's probably another reason, probably more of a physical explanation of nerve compression as opposed to blood sugar. Another thing would be if you had x-rays of the spine or possibly MRIs are there any discs where the cushions are worn down and thinning out, and that closes the space around the nerves that come out of the low back, which go to the legs and feet. So that would be something that may be visible on imaging. We see a lot of people that, in addition to having symptoms in the feet, ankles, calves, legs, it's one thing if they just have that, burning into the legs or feet, but if they also have pain in the low back or buttock or thigh or symptoms upstream, those would all be indications that there may be nerve compression that's causing symptoms into the whole leg, though it might be most intense in that person into the legs or feet, hence they see somebody and get diagnosed with neuropathy. Another thing would be whether the pattern of numbness or pain follows a particular what's called a dermatome. And this chart shows these different colors, like L5 shows yellow, and this what's called S1 is kind of pinkish here. L4 is dotted with white with red dots. And what we see in a lot of cases of neuropathy is there are multiple levels of the spine where there's some level of disc degeneration, bulging, things like that. And so a person may have more than one nerve involved, but if the pattern of the numbness really fits with one particular nerve or two nerves as opposed to being the whole foot, if it's along the course of one nerve, that would indicate more likely that the problem is in the spine. And then if there is a physical problem and you could relieve physical pressure, you're more likely to be able to get some help. So I hope this is helpful to somebody out there that's dealing with this. I find it's a commonly misdiagnosed problem. I've seen people that have been marketed various treatments and sometimes ineffective, and I shy away from necessarily telling people that just in general neuropathy could be helped. But if there is a physical clear explanation, in our office one of the things we do is called spinal disc decompression. So if there clearly is compression on the nerves that go to that section of the body, and it's happening from the spine and the discs, and you do what's called decompression on the disc, we've seen better results with leg and foot neuropathy doing that than we have other types of treatment. But it all kind of hinges on understanding what is actually going on there instead of just calling it neuropathy and doing some kind of treatment when you don't really know whether it's a physical thing or a chemical thing or something like that. If this is something you struggle with and you wonder if, hey, possibly there is a physical solution to that, we'd be happy to talk with you, evaluate your case, and see if it's something we can help.